Welcome to our live webinar session today, brought to you by the UWI Health and Wellness Committee through the UWI Mona Library. Thank you for joining us today. My name is Tamar Heron, chair of LHEWco, the UWI Health and Wellness Committee. Today, we are going to be presenting to you the emotional roller coaster of the COVID-19 pandemic. And we have two wonderful presenters here to share with us, Professor Donna-Maria Maynard and Dr. Katija Chan, both. But before we begin, let us do a little housekeeping. We are live stream on the YouTube channel, the Mona Library YouTube channel, and on the Facebook channel. So we are going to be asking persons there. We have a team to monitor what is happening there, and they will be ready and able to answer all your questions and comments from those platforms. We will have an additional question and answer after the presenter is finished. So please, by all means, use the inbox to pose your questions, and I will present them to the presenters at the end of their presentation or during their presentation. Now, without further ado, I will turn the platform over to Ms. Wall, who will bring us customary prayers, because this year is a year, well, I would say full of excitement, for lack of a better term. So we definitely need prayers. So to set the tone right, we'll invite Ms. Wall to open in prayer, and we'll hand it over to Dr. Carr, our campus librarian, to bring greetings to us. All right. Ms. Wall.
Good morning. Good morning, everyone. Let us pray. Almighty and ever-loving God, to deluge our speakers today with your inspiration as they share their vast knowledge in their respective topics. Lord, help us to absorb the invaluable experiences that will be presented today and put into practice the knowledge acquired. We pray that you bless the library's Health and Wellness Committee as we continue to realize our duty by reaching out and touching needs individually and collectively during this pandemic. I pray that we become living witnesses of your love through the enactment of the knowledge acquired in this webinar. We ask this in Jesus' name. Amen.
Good morning, everybody, and thank you so much, Ms. Wall, for setting the tone, as Mr. Heron has said to us. I am very pleased to add my words of welcome to this very important webinar facilitated by the UWI Mona Library. Special thanks to the Health and Wellness Committee led by Mr. Tamar Heron, who we all know as Stretch, who has led so much during these past few months with such a big heart. He has organized not only webinars, but sends us regular updates to staff in the library. And he is also our exercise coach in residence as he promotes healthy lifestyle, especially during this pandemic. This is the third webinar offered by the Health and Wellness Committee of the Mona Library. And while this particular one was initially aimed really at the Mona Library staff, we decided that the topic, the areas that it covers, we would open to a wider community. And so I'd like to welcome you all, those who are in on this Zoom meeting, those who are in on our social media platforms. Welcome, welcome, welcome. I know that we have in our audience persons representing various groups in our community. For example, I know that we have persons from the Library and Information Association of Jamaica. We have medical students, we have faculty of the UWI, we have staff of the UWI. So I'd like to welcome you all to this very, very engaging webinar. What a fitting title for a webinar at this time of the pandemic in the Caribbean especially. The last 6 months have indeed been a period of emotional up and down as we navigate so many aspects as they relate to us as staff, but as persons also. We were thrust into work from home without having any policies in place. And that unnerved some of our staff members. Some of our staff members initially were very fearful of that, you know, they would go once, if they got this virus, that they would die. And so there was a fear. And then when we were in lockdown, persons were literally depressed. I mean, I can't speak about clinical depression because I'm not a psychologist or a psychiatrist, but I do know that persons suffered all sorts of things. 1 minute you feel that, oh yes, we're having control of this thing, and then comes community transmission. And so we get into another aspect of the fear happening, and how do we deal with our stakeholders as library staff? How do we really keep ourselves safe as we are coming in contact with so many different persons? So I think this is a timely webinar, the roller coaster, the up and down. And sometimes you feel like you're getting there in a roller coaster and you're happy, and then you feel like your stomach is going out, you know? So who else to present to us but members of the UWI COVID-19 task force who have conducted research in this area? So I really want to welcome Professor Donna-Maria Maynard and Dr. Katija, and I hope I'm pronouncing it correctly. Dr. Khan, you can just tell us later on. And I'll just read short biographies of our presenters, and then I'll just invite them to start presenting. So Professor Donna-Maria Maynard is a registered clinical psychologist in Barbados and a professor of psychology at the University of the West Indies at the Cave Hill campus in the School of Education. She has a background in mental health and education with over 20 years of experience teaching in the field of psychology and counseling and providing clinical supervision for mental health practitioners in training throughout the Caribbean. She has published several scholarly articles and book chapters on identity development, psychological assessment, mental health, and psychoeducational issues affecting students and teachers. She is a past president of the Barbados Association of Psychologists and a founding member of the Caribbean Alliance of National Psychological Associations. In 2020, Professor Maynard was appointed as a member of the UWI COVID-19 task force. Dr. Katija Khan is a clinical psychologist and neuropsychologist, lecturer at the Faculty of Medical Sciences, UWI, St. Augustine, and a member again of the UWI COVID-19 task force. She is an executive council member of the Caribbean Alliance of National Psychological Associations and a past president of the Trinidad and Tobago Association of Psychologists. For the past 20 years, Dr. Khan has been a passionate lecturer, researcher, clinician, and public advocate promoting mental health and well-being across the Caribbean. Since the COVID-19 pandemic, she has been involved in multiple research projects to assess the psychological impact of the pandemic on UWI staff, students, service workers, and the public. She is also working with various stakeholders to promote stress management, psychological coping, and well-being in the age of COVID-19. Please welcome Professor Maynard and Dr. Khan as they address us in this very, very important webinar. Thank you so much.
Okay, good morning. First, let me thank the chair of the Mona Library Health and Wellness Committee, Mr. Tamar Hiron, for inviting us to present our preliminary findings to you all today. I would also like to extend my gratitude to those of you who were involved in the planning of this webinar. Thank you. All right. Okay, the novel coronavirus of 2019 was declared a pandemic in March 2020, by which point the Caribbean had already begun to record a few cases. The preventive behaviors recommended by the World Health Organization included social distancing and vigilant hygiene and sanitation practices, which have grave implications for university campuses worldwide, both residential and distance tertiary institutions, when considering the high level of human traffic that staff interact with. Now, one of the main areas of concern amidst this COVID-19 pandemic is our mental health and well-being. As we know, the heightened susceptibility to mental health issues, such as anxiety and depression, is great during a time when it feels like one has little control over one's environment and future. As we are familiar in this region with the psychological fallout from natural disasters such as hurricanes, this has been further compounded by the research coming out of China that has reported elevated incidents of stress and mental illness among their workforce. The COVID-19 pandemic has had wide-reaching effects in the Caribbean's response to curbing the spread of the virus. Preventive measures, as outlined by the World Health Organization, have been implemented across all campuses of the University of the West Indies and include, among others, social distancing, that is staying 3 to 6 feet apart from others, use of PPE, personal protective equipment such as the masks, and frequent sanitization of our hands. I'm going, to briefly present to you the main findings thus far from the UWI Regional COVID-19 Task Force Staff COVID-19 Impact Survey and the key recommendations based on those findings. Just to give you a quick overview of my presentation today, I'm going to cover the following: a brief background to the study, purpose of the study, the participants, results, and recommendations. On March the 17th, the UWI established a special psychosocial operational unit within its regional UWI COVID-19 task force. One of the first mandates of the psychosocial unit was to conduct a psychosocial impact survey of both staff and students. I'll be reporting on the staff findings today. On April the 9th, the UWI Rapid Response COVID-19 Impact Survey was launched across all 5 of our campuses. Okay, the survey aimed to identify the mental health and psychosocial problems that the UWI stakeholders may be experiencing during the COVID-19 pandemic. Now remember, we started fairly early, so this would have been in the first few weeks of when COVID-19 hit the Caribbean. A key element of responding to these problems is having a better understanding of the needs of the UWI staff at this time. The findings of this research will inform the UWI COVID-19 task force as to relevant psychosocial support and resources and interventions that could be implemented across the Caribbean, both at the macro 1UE level, as well as at the micro level of our individual campuses. So the aim of the survey, therefore, was to ascertain the UWI staff's emotional response to the COVID-19 pandemic. Also, to identify the university-related challenges that staff are encountering, as well as to understand the current concerns that staff have during the COVID-19 pandemic. In terms of the data collection, the survey was administered via SurveyMonkey, so many of you would have seen it. This is an online survey platform that we use. The survey ran for about 3 weeks, from April the 9th to May the 4th, on all 5 campuses. We gained cross-campus ethical approval through the Cave Hill Research Ethics Committee, which was supported by the ethics committee of the other campuses. Participation of staff was invited via email from the planning or marketing offices across the campuses. We also used social media as a way to get the survey out there, and this was used especially to promote participation among ancillary staff. Okay, so we would try to capture as many people as possible in the survey. Okay, so the questionnaire was used to collect demographic information, and as you can see, there were no major differences across the 3 landed campuses. So for instance, the participation from academic staff was roughly a third across Cave Hill, Mona, and St. Augustine. Then we have age categories of staff. Here you'll see that the majority of our staff that responded fell into the age range of 31 to 60 years old. Okay, that's where the bulk of our staff, our sample fell. The questionnaire was used to measure staff's psychosocial concerns, as well as mental health problems, that being anxiety and depression. We also wanted a picture of the level at which staff members were dealing with COVID-19, and for that we measured their resilient coping. Okay, so these were clinical screening instruments that we used and were incorporated into the overall questionnaire. All right, so first of all, let's take a look at anxiety, which, as was mentioned earlier quite rightly, a lot of us would have been experiencing anxiety at the very beginning of this pandemic. Anxiety is a feeling of unease, such as worry or fear, that it can be either mild or severe. Some people may find it hard to control their worries. Their feelings of anxiety are more constant and can often affect their daily lives. Symptoms of what we call generalized anxiety disorder, and the measure that we used in the survey is known as the GAD-7, can cause both psychological and physical symptoms, which vary from person to person, but they can include feelings of restlessness or worry, having trouble concentrating or sleeping, dizziness, or I should say, and dizziness or heart palpitations. So these are the kind of symptoms that we experience when we have anxiety. Moving on, you'll see that from the data that we collected, so from our sample, in total, 13% of staff reported symptoms of anxiety, and in the moderate to severe range, indicating a need for clinical diagnostic evaluation. So 13% in total. So we're looking here at the gray and the yellow segments of the pie chart. And in terms of age, we found that older staff, those that fell between the age of 51 to 60 years old, reported less anxiety than the younger staff, those aged 31 to 50. Okay, so we're now going to move on to depression. Now, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and or a loss of interest in your daily activities. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Symptoms of depression can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in one's appetite. It can either result in weight loss or weight gain that's unrelated to any change in diet or any purposeful change in diet. Trouble sleeping or sleeping too much. So those of you who've been experiencing insomnia over the past few weeks, that's an indication. Loss of energy or increased fatigue, increase in physical activity that has no purpose, such as hand wringing or pacing up and down, or slowed movements and slowed speech are also indicative of it. These actions are actions that are often observed by the people who are around you frequently. So those would be your family and your work colleagues, okay? Also experiencing feelings of being worthless or guilty and having difficulty thinking, concentrating or making decisions, and possessing sometimes thoughts of death or suicide. Okay, so depression among our sample of staff, as you can see here, 59% of staff reported minimal to mild levels of depression, and 13% of staff reported moderate to severe symptoms of depression, which indicates a need for clinical treatment. Okay, moving on. So we're moving on now to resilience. Okay, so this is the flip side. Now we're looking at those who are coping and doing well, resilient coping. This is the ability of people to maintain relatively stable and healthy levels of psychological and physical functioning when confronted with a highly disruptive situation, such as this COVID-19 pandemic that we have with us. Factors contributing to resilient coping are having the capacity to make realistic plans, conducting those plans, effectively managing your feelings and impulses in a healthy manner, communicating your thoughts and feelings clearly, having confidence in your strengths and abilities, demonstrating good problem-solving skills. Remember, resilience is the capacity or the ability to rebound from and positively adapt to significant stressors. So despite experience of significant adversity or trauma, some of us have this sense of resilience where we are able to bounce back and cope with the situation. In terms of resilient coping among our sample of staff, just under a third of the sample, 30.5% of participants, fall into the low resilient coping range. Okay, so roughly a third aren't doing too well at all in terms of coping. Then we have 31.75% of participants who report high resilient coping. Okay, so we do have a decent cohort of people out there that among our staff who are coping quite well. Low resilient coping, I got the wrong thing here. Low resilient coping was found for the 25 to 30 and 61 to 65 age groups, especially. So that's the younger faculty or the younger staff members and the older staff members. That's what we're finding there. Okay, in terms of the major concerns that staff have, we asked staff on the questionnaire to rate their level of concern for several psychosocial issues before and during the pandemic. So we asked the before account is asking them for a retrospective account of how they would have rated these psychosocial concerns. And then now that they're actually in the midst of this pandemic, during the pandemic, how they rank. Now you'll see here on the left that the top 5 ranked concerns, according to the sample before the pandemic, were managing finances, physical health, fear of failure, pursuing educational or professional goals, and management of stress. While during the pandemic, the focus shifted slightly to falling ill or getting sick, becoming the #1 concern. And then you see that managing finances shifted into second place, and then we have managing work responsibilities, because of course, as mentioned earlier again, many of us had to work from home, you're working online, you had to relate to your line manager in different ways because you weren't physically on the plant. And then physical health was a concern. It also was a concern before the pandemic, and physical health I'll speak a little bit more about in a minute. And then finally, management of stress. And as you can see here, when we look at the overall rating of these psychosocial concerns, you can see managing finances dropped to second place and was replaced by falling ill, which is expected given the highly contagious nature of COVID-19 and the increased vulnerability for staff, especially those who have unmanaged non-communicable diseases such as hypertension and diabetes. Hence, such a shift in concerns makes sense as the increased likelihood of having to quarantine and seek medical treatment is likely. In terms of physical health, it remained during the pandemic. It was a concern before and it remained as a major concern. Now, physical health could also include maintaining your fitness level through exercising and going to the gym, which these were activities that may have been restricted at the time of data collection. I know in Barbados, all of the gyms closed down during that period. Okay, so people that are accustomed, that's part of their lifestyle that's built into their habits, were not able to continue with that. Interestingly, as I said, mentioned and pointed out to you, management of stress retained its 5th position. Okay, so it held that 5th place before and during the pandemic. And this is concerning because when we are stressed, it can not only further impact our health, but can also impact our decision making, which could undermine our ability to manage both our work and our home responsibilities. So even though it's placed in 5th in terms of the rating of concerns is still a major concern that we need to take into consideration. Now, the 5 main findings of the study are as follows. 1 in 4 staff members are experiencing anxiety at the moderate to severe level for which clinical treatment is recommended. 1 in 8 staff members are experiencing moderate to severe symptoms of depression. The top 3 major concerns of the staff during COVID-19 are fear of falling ill, managing their finances, and managing work responsibilities. And younger staff are experiencing more anxiety and depressive symptoms than older staff. Just under a third, 30.5% of the staff reported low resilient coping. So now we're moving on to the recommendations, looking at the way forward to ensure that the necessary psychosocial support is provided for our UWE staff. Okay, so first of all, there's a need to provide access to mental health resources in the workplace. In order to address the anxiety and symptoms of depression being experienced by staff, counselling services specifically for staff can be provided. Such counselling services should be offered using various modalities, such as online, can be offered both synchronously and asynchronously, by telephone, and in a face-to-face environment with the necessary PPE and physical distancing. Mental health stigma and issues of confidentiality should also be taken into consideration when these services are being provided. The university may possibly consider outsourcing counselling services by using external agencies to administer and deliver an employee assistance program. Such an intervention would have the potential to alleviate much of the psychological disturbance that staff are experiencing and assist them in managing stress and their work responsibilities. We can also consider psychological self-help, which can be supported through the provision of counselling services for staff with milder symptoms of anxiety and depression. Self-help can be promoted by providing links to online materials and guidance through audiovisual materials, webinars, and even a mental health awareness day, all of which can be independently accessed and used by staff. Moving on now to promoting COVID-19 preventive practices. Right, much of the anxiety that we had in those early stages was the fact that we would have to trust that others are going to adhere to the necessary preventive practices in terms of the washing the hands and the sneezing in the arm and so forth. Now, to address the concerns of fear of falling ill or sick, the provision of personal protective equipment, frequent sanitization within the work environment, reinforcement of personal hygiene practices, and separate entry and exit points for visitors and students are necessary. Such preventive measures, thoroughly administered and supported, will also help to alleviate some of the anxiety related to the fear of contracting COVID-19, as staff will feel as though they have more control over their work environment. Furthermore, facilitating, where possible, staff working from home can also assist in reducing the fear of COVID-19 contagion. Various options exist to support reduced numbers of staff in the physical workspace, such as utilizing a shift system for administrative and maintenance staff, or we could measure, such a measure, would also address concerns of managing work responsibilities as well as the fear of falling ill or sick. We also can consider promoting holistic health and disease prevention. With regards to the staff's overall concern for their physical health, increase in regular and consistent health and wellness messaging across the UWI is highly recommended. Implementing a holistic biopsychosocial approach would support the dissemination of information on all aspects of health and well-being. That is mental health, nutrition, physical health, and even spiritual health. Such an intervention may also serve to normalize psychological health care and support the destigmatization of mental health, also allowing for practices related to disease prevention and proactive interventions, such as boosting one's immune system through good nutrition practices and healthy lifestyle decisions. This would also address concerns of fear of falling ill or sick, managing stress, as well as overall physical health. And it will also help to release some of the anxiety that people have about falling ill, okay, or as it relates to falling ill. Okay, now if you remember, managing finances was on the list of major concerns. So maybe we need to consider teaching money management skills, okay, to address the concerns of managing finances and stress. We could use webinars and messaging on how to make your money go farther, for example, through growing vegetables or making your own PPE masks or making them and selling them. Anything like that would be useful, giving tips and ideas of other ways that you can maybe supplement your income while relaxing your mind and partaking in something that you might enjoy. Okay, so in addition to mental health sensitization, training of senior administrators and leadership of university should also be considered, helping to highlight the real psychosocial concerns that staff have at this time. You know, some staff would have been fearful that they may lose their job, or they have someone within their household maybe who has lost a job, so there's not so much money coming into the house. So looking at creating ways in which we can supplement incomes and so forth would be a great stress reliever at this time. Okay, improved communication. In terms of managing stress, we also propose that clear, accurate, and consistent communication should be practiced, informing staff of all necessary changes in the workplace that affect them directly. New rules and regulations to keep everyone safe should be communicated using a variety of media to ensure that the information reaches everyone. It's important to communicate with our colleagues. Staff should share and explain their work-related concerns with their colleagues, and together you all should work to identify solutions within your work environment. Increased mental health awareness. Okay, there's a need to sensitize all university staff to mental health issues and psychosocial concerns of the staff. Sensitization can include mental health literacy training of senior administrators and leadership of university, which will help them to recognize the signs and symptoms of mental health problems, gain knowledge of risk factors, self-treatment, how someone can help themselves, and how to access mental health information. Okay, such knowledge should help to alleviate the concerns of managing more work responsibilities and managing stress within the work environment. Now, you have to ask yourself as well, what can you do? Okay, and really and truly, self-care is very important. It's important regardless of whether we have or in the midst of a pandemic or not. But you need to make time for self-reflection, rest and relaxation, which are essential for mental and physical health. Try meditation and prayer, stay connected with your friends, family, colleagues and support systems. Set appropriate boundaries with work, family and media, especially if you're working within the home environment. Now, given the findings from the survey, it can be concluded that majority, or I should say given the findings thus far, that the majority of the UWI staff are not experiencing severe mental health detriments. The percentage, the regional percentage of mental health issues is really around 25%. And when we look at the severe categories for both anxiety and depression within the data that we collected, it's around 13%, okay? So it suggests that many of us are coping during the beginning of the COVID, or were coping at the beginning of COVID-19 when it first reached the shores of the Caribbean, all right? And when we looked at the resilience, we see that it's broken into thirds, and there's a third that are high resilient coping, a third that are low resilient coping, and then a third that are moderate, okay? So we can see that what's going on with it as it relates to resilient coping. However, it is necessary for us to survey staff again, since the landscape of COVID-19 has changed significantly since we initially collected that data all the way back in April. Hence, I thank those of you who responded to the survey and urge you all to do so again in the second wave of data collection, so that we're able to continue making informed decisions for your health and well-being at the UWI based on accurate data, rather than us just trying to imagine what it is that you're experiencing. We need to be able to have that data and analyze it and move forward in an informed way. I want to thank you again for your time, and when the floor opens up from questions, you're welcome. We'll address all of your questions. Thank you very much.
Oh, thank you, Professor Maynard. I must tell you that this COVID-19 pandemic has really rocked us hard, to say the least, because, you know, we have never experienced this before, anything of this magnitude before. And it has really and truly taken us aback. So much so where, you know, anxiety is so high among us, especially here in Jamaica, where it's now community spread. And more persons are worried about losing their jobs.
Yeah.
How is it that we can say to someone that we need to self-care when we are thinking about how the bills will be paid? As you said in the survey, has shown that it has shifted during the pandemic. How would persons, what would you suggest to persons who think that the world is coming to an end?
Okay, the first thing that I would suggest is that you draw on your strengths, your support group. So if your support group is within your family, within close friends, you speak to them, you think about ways. Now remember, if you're experiencing anxiety, as I mentioned, it can affect your decision-making skills. So by speaking to other people, by seeking help from a counselor or a psychologist, if the services are available free on the campus, by engaging in those type of interactions and drawing on that strength, hopefully you'll be able to work through some of the fears that you have and some of the concerns that you have. Now, there's no way that we can guarantee what's going to happen in terms of job losses and so forth, but regardless, we have to live. Life has to continue. So you need to draw together and support each other. And we also need to be very cognizant and very aware and observant within our work environment, and notice when colleagues are not responding the way they normally respond, and you know, maybe are becoming withdrawn. We have to be brave enough to help them, to seek help for them, or to talk to them, and to move forward.
That's interesting. Because just to go back a bit, because what we have done is to make a comparison with the H1N1 series. We have a series of it on our YouTube, on our Instagram channel, and what we found was that persons were really not taking it serious back then in the Spanish flu, and here in 2020, when the information is right at our fingertips, I still don't believe that persons are getting the correct information in order to make good and sensible decisions in their daily life. Um, how best can we go about educating persons again, because it's all through education while we'll overcome this. How best can we educate persons so we don't have a repeating history with the Spanish flu in 1918 and now here in 2020?
Okay, it's a good question. What I will have to mention, even though we did not address it directly within our study, but I am involved in some other research where we've looked at the knowledge and the messaging that has been received, and the knowledge that people are deriving. It comes largely from social media, and not necessarily, you know, people's opinions and people misinformation. So that obviously helped to fuel much of the anxiety that people would experience. So I think it's very important to direct people to credible sources of information. The COVID-19 task force has a website where we've posted information that's coming from credible sources, drawn from empirical data. It's not people just throwing out their opinions saying drink ginger tea and you'll be fine. You know, so you need to make sure that you access incredible sources of information and make your decisions based on that rather than hearsay and what you're receiving from social media. Okay.
Okay. We have a question or a comment coming from the chat. In relation to the high anxiety level, was this observed more in any particular category of staff? This person is curious about the difference in anxiety experience between the academic and the ATS, for example, or
so,
even further breakdown in the level of the ATS staff in this data.
Okay, so thank you for the question, but you're way ahead of us. As I told you, these are the preliminary findings. We haven't got to that depth of analysis quite yet, but we will do, and you know, papers will be published and we'll be able to share that information. I'm sure that we can come back again and present the information as it pertains to the different demographic variables and occupational statuses of our staff members. But these are the preliminary findings that I presented to you today. So I haven't looked yet at those differences between, let's say, academic staff and administrative staff and so forth.
Okay.
Good afternoon, Professor.
Good afternoon.
Good afternoon. Yes, I have a question. What methods could we use showing signs of depression or the effects of COVID-19, but they are reluctant to come out and seek help? What could one do in this case?
I'm sorry if I may. You're not Conrad. All right. So we're not hearing you quite clearly. All right. So I'll also use the opportunity to invite persons to use the chat because we're not hearing you clearly what the question. So if you could type the questions in the chat, and then I'll direct it to Professor.
Tamara, Dr. Khan here. I just wanted to say the little I heard of the question being asked might pertain to the other presentation in terms of coping with the fallout of the pandemic and how we might identify signs that somebody is struggling. Yes. So perhaps Conrad can hold out for the second presentation and maybe that question might be answered then.
Okay, thank you, Dr. Khan. All right, and well, we'll just use this opportunity to move into your presentation, and we'll have the questions to follow after. So welcome, Dr. Khan.
So thank you, Tamar, for the introduction. And yes, Ms. Kerr, you did pronounce my name perfectly well. I'd also like to thank the Library Health and Wellness Committee for the invitation to present, to share some of our research findings, but also to help boost the coping amongst our staff members. So over this next 15 to 20 minutes, that's what I'd like to share with you, some tips and some strategies for how we can cope better. Okay, so one thing we know about this pandemic, and I'm also trying to just share my video because I like to, oh, there we go. All right. So one thing I think we might all agree, and it was mentioned in the introductions, this pandemic has taken us all by surprise. It's unprecedented. Nobody could have predicted the kind of impact it would have on us. And so when we look at sources of stress, we can see that this pandemic ticks every major category. Is it a traumatic event or a major disaster? Yes, certainly a global health pandemic is. It's caused also a number of life changes and strains. Everybody has had to make changes, whether it's in our work life, having to adjust to remote work, utilizing more technology, maybe changes in our roles, and also in our personal lives, there have been significant changes. And these changes have also been chronic. So perhaps when the pandemic started, it was a bit novel, it was a bit new, we were all trying to wrap our heads around it. Little I think did we expect that 6 months down the line, 7 months down the line, we'd still be caught up in the midst of it without any clear idea of when it might end. Certainly not before the end of 2020. So it's also a significant chronic stressor. And finally, it poses daily hassles. So whether we're talking about your internet giving some trouble in terms of your connectivity, or you stepped outside and you realize you forgot your mask, we also find that there are a host of daily hassles. And so we add all of these together because unfortunately, stress doesn't affect us one stressor at a time. We have multiple stresses that we are facing that are pandemic related, plus there are also all the stresses that we would have been facing in our regular lives, both pre-pandemic and now. So what we've realized is that people are facing heightened levels of stress and anxiety as a result of this pandemic. So in order for us to cope effectively, one of the things we need to understand is how is this impacting me? How is it impacting me, but also how is it impacting my family, my colleagues, etc. So let's look at some of the ways that stress affects us. And while I'm going through this, I'd like you to do your own personal stress audit. Have a look at this list and think about how have you been affected over these past few months and weeks? So the first category is the psychological and emotional, and I do like the title you chose for this session, this emotional roller coaster. So I think this is the most popular stress reaction that people are familiar with, that stress takes a psychological toll. So some of us might be feeling more worried and frustrated, some might be more irritable, angry, agitated. Maybe you find yourself feeling overwhelmed, find it difficult to relax and stay calm. But stress can also take a cognitive toll on us. So if you've been finding that you've been having more problems with attention and concentration, you find it difficult to focus, things that you could easily remember, now you have to make a list to keep track of your things to do. Maybe you find yourself being a little disoriented, having difficulty making decisions. So these are all some of the cognitive symptoms that could be the result of stress. Stress can also impact us physically, and in two ways. And the first way, it can cause these physical symptoms. Have you been feeling more tired than usual? Just fatigued without any particular reason? Maybe you've been feeling more aches and pains, more muscle tension, more headaches, toothaches, indigestion, etc. So stress can affect us in that way, but it can also exacerbate your existing medical conditions or bring on medical conditions. So if you are dealing with a medical illness, you also want to be aware that stress can exacerbate this. So those are three of the areas, but then there's a fourth area. Stress can also take a toll on our social and behavioral functioning. So if you've been finding yourself being more suspicious or paranoid, maybe more overprotective of your family, maybe you're getting into more arguments with loved ones and friends or people on social media. Have you been isolating, withdrawing from activities? Maybe it's been affecting your appetite, your sexual functioning, or your use of substances. So what we're seeing then is that there are all these different domains that stress can impact us. And one of the main takeaways I want you to have today is that our stress reactions are subjective and they're variable. What does that mean? That there is no one prescriptive way to respond to stress. So you might have been noticing this, whether it's amongst your family members or your colleagues or your friends, people react differently and they react with different intensities. So somebody might be affected more in terms of anxiety and depression. And we heard about those variant figures in Professor Maynard's report. So it was 1 in 4 who are affected by anxiety to levels where they may need a clinical evaluation. And given the number of participants in the session here, roughly that amounts to about 12 of us. 12 of us in this session now are likely affected by anxiety to the extent where we might need to get evaluated by a professional. For depression, it's about 1 in 8. So maybe that's about 7 of us right now who are dealing with symptoms of depression. So this is something that is very real, it's very tangible, and it's worthwhile for us to be aware of how we are being affected, and also those around us, so whether it's our family or our work colleagues. So on that note, how will you know? How will you know if you're struggling or if your colleague is struggling? So let's say you are experiencing some of those symptoms, but stress is inevitable, isn't it? Stress is ever present. So how would I know if the stress I'm experiencing is at a level where I might need some help? Well, here are some ways. If you realize that you've been experiencing negative changes in your mood and your functioning over a sustained period of time, then that's a sign. So we all have fluctuations in our mood. So we talk about our roller coaster. So some days you might be coping okay, and then there's some days you're just frustrated. You just had it. When will this pandemic end? When can life go back to what it used to be? So if you found then that you have had these sustained changes, negative changes, so your mood does not rebound to something positive, then that's a sign. Has your productivity consistently declined? So again, you may have an off day. You may not complete all the tasks you want to. You may fall behind on a deadline. You may be struggling to keep up with your workload, but then you're able to catch up. But if you found that it's consistently declined, that's also a sign. Sometimes we're not aware that we're struggling, and others might express concerns about us. Check in and say, are you sure you're okay? You don't seem to be doing too well, or you seem to be struggling. So sometimes others might bring it to your awareness. Or if you're talking about a colleague, they may not be aware, and so you might have to identify it for them. And finally, are different aspects of your life being affected? So our mental health doesn't always impact us the same way in every sphere of our life. It can, but sometimes it may affect you more so in one than another. So you want to look at all of them. How are you functioning personally, at work, socially? And so here are some tips and some strategies of ways that at the organizational level, at the office level, that you can promote healthy strategies for coping. So an important one is having fora for input and feedback. So a session like this is important because then you also get to interact and ask questions. But it's really important for departments and units to have fora where people can ask questions, especially if they have concerns about their work roles and expectations, working conditions, etc. We heard about the importance of communication in the recommendations in the previous presentation. So having timely information and updates is important. This pandemic is changing. Every day we're hearing about new infections, etc. And so timely information and updates is one of the things that can help reduce some of that cognitive stress. Training opportunities, communication, more supervision. Some of us have had to upskill. We've had to be much more savvy with things like Zoom or Blackboard Collaborate, etc. And it's also important to have the sources of support. So do you know how to access the university's EAP system? Do you know where to go online to get resources? And then perhaps you may have this unofficially in terms of a buddy system, and I'll talk a little bit more about that. And you know what? It's always important, no matter where you are in the hierarchy, which department, what kind of work you're doing at the university, it's really important that we affirm and recognize people's effort, their sacrifice, their commitment. This is a very challenging time for all of us, and we really do need to take that time out to commend people's work and to show them that we value their efforts in times like these. So if you are a leader or a manager or a supervisor, you're also encouraged to check in with your colleagues, your students, your employees. Check in and find out what they need and how they're doing. So let's not just assume that we know what people need, but let's get it straight from the source. Now at the peer level, so I mentioned that buddy system, and what is it? So it could be a formal or an informal system where you pair up people or you have a small group, and their role is to check in with each other. So especially if you have a large unit, so everybody can't check in on everybody. It's not feasible, it's not practical. It's good when you have a smaller buddy system where you can check in with people and see how they're doing. And social groups and social networks can also be important, both for work-related reasons or social reasons. There you can share with each other, you can crowdsource solutions. If you're trying to figure out how to navigate something, I'm sure somebody there might have dealt with that before, and so you can find out from them. You can share how each other is coping. But here's the caveat. The quality of the social support is important. When people have social networks with high levels of conflict and bacchanal, they show poorer physical and emotional health after a stressor. So you might want to do an audit of your social support networks, and especially maybe your social media groups, and see if maybe you need to mute a group, exit a group, unfollow somebody. So if you realize being in that group and interacting in that group raises your anxiety levels, maybe you don't need to check in with that group as often. Okay, so you do want to be cognizant of the quality of the kind of social support you let into your life. As it pertains to health, this has been a very robust finding in the literature that stronger social relationships are associated with a 50% increase in survival rates. So it's associated with better health outcomes. Okay? So as we're talking about supporting each other at the peer level, how do you do that? How do you check in with each other and find out how people are doing? Sometimes people are a little bit hesitant because they think, you know, you don't want to be feisty and out of place. You don't want to mind people's business. So sometimes it's about how do you tread that line of checking in, but not being too intrusive. And so it's important that we have the narrative in our head. We have the words that we feel comfortable using in order to check in with our colleagues. So for example, I like this list here. It gives 10 simple questions. So for example, how are you feeling today? When was your last full meal, or have you been drinking enough water? But you know what? We don't necessarily speak like that in the Caribbean. So I did another slide, and you have to pardon me. I'm Trinidadian, so I put this in Trinidadian dialect. And I lived in Jamaica, but this was over 13 years ago. And so my patois is a little rusty. So you will have to translate these into Jamaican patois to ask. So Tamar, how you going, boy? And you know how sometimes we give that polite response? I'm okay, I'm good. So what we want to do in times like these is make sure you have the time. So you're not walking past each other in the corridor. It's not a quick interaction where you are inclined to give that polite response. You want to make sure you do have a little time to listen and to ask. So how are you going? Really? You know, and the check-in. So I do this all the time. My friends and colleagues know this. I always ask people, you're drinking enough water, you're eating properly, because I'm a big fan of being hydrated and the importance of things like hydration and being properly nourished for your mental health. Many of us may be familiar with being hungry. So when you allow yourself to get hungry, you're more likely to feel angry and irritable. So things like you're being tired, things like being hungry, etc., things like not exercising can impact on our mental health. So hopefully you have in your repertoire 1 or 2 statements that you can use to check in with your colleagues. And it's important to have a range of coping strategies. So a question was asked, you know, when people are dealing with some serious issues, finances, bills, work responsibilities, how can we talk to them about self-care? That sounds like psychologists just being unrealistic, but no. What we have found is that, and I like this maxim here in this graphic, you cannot pour from an empty cup. If you allow yourself to become so depleted, so exhausted, so frustrated that your tank is empty, then you're not going to be able to attend to any of the other things you think are priorities. So you know, on the airplane, they tell you, put on your own oxygen mask before you tend to your child. It's the same concept. So do not see self-care as a luxury. I'm not talking about getting your nails done because you think that that is a treat. Or it could be that when you get your nails done, it makes you feel a little bit better about yourself and it gives you a boost. And that boost gives you a little more energy to motivate you to cope. So self-care is not a luxury, self-care is a necessity. Okay? So we want to engage in more problem solving, emotion management, taking that me time, using a sense of humor, being kind to yourself, doing that self-care. And this notion of perfection. So you know yourselves, those of you amongst us who have those perfectionistic traits, who want things to be perfect and lined up this way. Now is not the time for that. That can actually increase your stress. What you want to do instead is embody resilience and coping. And this is good for us as leaders so that our employees and colleagues can see that. It's also good for those of us who are parents, for those of us who are partners, so that our children and our loved ones, they can see that the important thing is about being resilient and coping well and not being aiming for perfection. Okay, so in the chat, is it possible for you all to quickly in the chat indicate for us, what have you been doing to relax and recharge? Have you taken up more gardening? Are you cooking more? Have you been making your own masks? Have you been playing with your pets more? Have you been spending more quality time with family? Tell us what you are doing to relax and recharge and to take the edge off of that. To prevent yourself from feeling your mental health slipping into levels where you feel you can't cope. So I'm just going to have a quick look at the chat. So I see Jessica is engaged. She's cooking and baking. Who knows, Jessica? You know where to visit, right? Of course, social distance. Yes. So Bernadette is taking road trips, driving into countries and sightseeing. And Bernadette, I'm assuming you're in Jamaica. The Jamaican landscape, stunning, gorgeous. Rishana, doing your nails and hair, you find that relaxing, and doing arts and crafts with your son. Fantastic. Okay, so I'm glad to see some of these ideas coming up. And this is going to vary for each person. So it's good for you to have a variety of ways and a repertoire of different kinds of coping strategies. Audrey, you watch game shows with your daughter, and do you all compete and try to guess the answers, have good fun? Rashana is cooking more, having more stimulating quality conversations, playing games. Therese is reading more mystery novels. That's good. And that's good because it keeps you off of a screen because we're spending so much time on screens. Patrine, exercise, fantastic for mental health and reading more. So that's really good. Thank you all for sharing. What I wanted to end off with was just a couple relaxation techniques. And I selected techniques that have been, that have evidence, research evidence that shows that they're effective, especially in high stress situations. So I wanted to share those three with you. And I know that we're short on time because normally I would have liked to take a minute or two to actually do these with you. Let me check in with our host. Tamar, can you tell us how much time we have left?
You have about 5 minutes left for you.
Okay, so we can perhaps do one of these. I'll save, we'll do the last one. So this first one is called progressive muscle relaxation. And especially for those of you who may be feeling some of those physical symptoms of stress, maybe you get the tenseness in your jaw, your neck, your shoulders, your lower back, etc. Progressive muscle relaxation teaches you to relax your body in a two-step process. So just with me now while I'm saying it, pick a muscle. So let me choose a muscle. So let's choose your feet, rest them flat on the ground, and I want you to tense and hold. 2, 3, and relax. 2, 3. Now you need the contrast of the tense and the relax to get the gains. And you don't want to tense too much. You shouldn't feel any pain or cramping. So with this exercise, you're going to start from the bottom of your body and move up your muscle groups. If you have more time, you can do this more slowly and isolate more muscle groups. But you're breathing steadily, and you're focusing on each muscle group, and you sequentially tense and release. So that's progressive muscle relaxation. Here's the next one. So mindful breathing. So if you maybe found, you feel overwhelmed, all these thoughts in your head, you can't seem to get a moment's peace. If you engage in a lot of rumination, so you're overthinking and focusing a lot on problems and issues, this might be helpful. So what does the mindful breathing involve? So you can set an alarm on your clock. I put 15 minutes here, but if you have 5 minutes, set it for 5 minutes. You don't want to sit comfortably, keeping your mind focused on the flow of air and the movement of your belly. So you do want to do belly breathing. When you breathe, if your shoulders are coming up, you're doing it wrong. So I want you to breathe from the diaphragm. Think about having a balloon in your stomach. And as you breathe in, that balloon inflates. Now, as you're concentrating on the breathing, you may find thoughts entering your head. And what you want to do is just refocus on the breathing. So breathe 100 times if you must. Let the thoughts come, but then let them go. And don't worry if you find that you keep getting distracted. That's quite normal. The more you do this, the better you will get at it. So this one is called mindful breathing. And the last one, and this is one of my favorites, it's the one I do almost on a daily basis, positive thinking. So positive thinking is a quick way to boost and reduce sad and stressful thinking. Research shows that a ratio of 3 positive emotions to every 1 negative emotion can help people flourish. What does that mean? It sounds so unrealistic, mathematical. How do I calculate 3 emotions for every negative emotion? But what we want you to do is to picture something positive. So it could be a positive moment. So a naseberry's in season now. Maybe you've had a really nice, sweet, perfectly ripened naseberry recently, and you can recall it. Maybe it's a bird singing, your child's laughter, a nice cool evening breeze. Maybe Bernadette, an image from one of your road trips. So calling that image to mind can give you that boost. Another variation of this, and I know everybody has pictures in their phone, but you also want to keep the picture in your mind and you can call it to mind. So think of a picture you have that makes you feel happy or confident or safe or successful, whatever you feel is the mental boost you need at the moment. So I'm sharing a few of mine here. These are my nieces and nephew. We just, you know how it is with little kids, trying to get them all together for a picture with no monkey faces. So they're all looking cute there. So I love this picture of them. They got dressed up for Diwali one year. The middle picture is, it was a day when I had so much work to do. I was trying to mark papers and simultaneously working on a project on the computer. But my kitten decided no, she was having none of that. It was her time. And she came and she sprawled out, as you can see on the laptop. And you know what? I paused, took a step back, took a cute picture. And now I also have this lovely memory. And on the right, so for example, the beaches are closed in Trinidad. We have no access to public beaches and rivers. It's very stressful for many of us. But you know what? That's my memory of Pigeon Point. One day I'm going to get to visit again. And for now, I'll enjoy the image. So hopefully you have some positive images. And as we close, perhaps you could share with us, what is your positive image that you could call to mind? Is it your kids? Is it your pets? Maybe a fantastic meal you cooked and you took a picture of? Is it a beach? So share with us in the chat what your coping strategies are. So we've shared a few. So hopefully at the end now, you have a better idea of how stress has been impacting you, how you can check in with a colleague, what are some strategies you can employ in the workplace to help you boost each other's mental health. And also, hopefully you'd be able to try one of these 3 relaxation techniques to help boost your mental health. And with that, I say thank you.
Wow, I tell you, before I comment on the presentation, let me just remind persons that you're invited to comment in the chat. All right, you can have your questions there, or you can raise your hands or your hand and be identified so you can ask your questions. Dr. Khan, I tell you, thank you very much for that very insightful presentation. I almost feel relaxed already because I'm still contracting the muscles in my body and relaxing, and the picture with the cat on your paper I thought that was an awesome. I thought it was Photoshop, but I'll take your word for it that your cat really gave
It's
you the
real.
break that you needed. Right. What is interesting about both of your presentation and this webinar is that just last week, we here in the Caribbean celebrated well-being in the Caribbean, stronger together. And I thought how appropriate that is to tie into both of your presentations. It is welcome and I love it. Right. Let me just ask a question here. We know that anxiety, pacing, as you said, comes from all angles. But we are, again, having the community spread. And once we enter the campus or a building, we become paranoid, so to speak, about who has the virus. Should I ask this person to put their mask on? Should I go wash my hands now? Or maybe, we slip for a moment, not remembering that we're in a pandemic and this virus is all around on the surface of things. And we put the food in our mouth without realizing. And then I become so paranoid. What kind of suggestions would you offer to persons like that, who are paranoid about their surroundings?
Okay, thank you for
And
that.
I'm using the word paranoid loosely.
Yes. But I think many of us identify with exactly what you're saying. We find ourselves becoming more hyper-vigilant, more observant and cognizant of these things in our environment, things that previously we never would have had to be aware of. So a couple of things about that. So one of the very stressful things about the pandemic is the uncertainty. So we are not quite sure what's going to happen. We don't know exactly what our risk factor is. So is it okay if I talk to someone with their mask under their chin, or should I be asking them, could you put your mask up, please? So one of the things that helps with that is the things that we do have control over and the things that there is certainty for, let us take advantage of those. So for example, if in your building there are certain rules and regulations, let's enforce them. Let's be compliant. So for example, I had an experience like that. I was in the secretary's office at work. And then when I turned around to exit, there were 3 people by the door. And I immediately felt a sense of immediate anxiety and a little bit of claustrophobia. And so I was just like, whoa. And then I said, okay, I think somebody's going to need to back up, because I wanted to enforce some of that physical distancing. Because I know it would have made me feel anxious having to now try to maneuver my way. So the things that we know are established. So we want people to wear masks properly over their nose. We want people to sanitize. So we can say nicely, oh, have you sanitized? So I was at another event and I was actually the one with the spray sanitizer. So it's just very pleasant. Oh, have you sanitized? And I went around spraying. So those are some things in terms of having your routine to establish that. Also, once you're aware that you have these anxieties, you might also want to take a step to question what's realistic, what might be the anxieties getting the better of you. So for example, which is a realistic fear or not? So are you overreacting, or is this something that you really feel strongly about? So let's be a little aware of ourselves. So for example, might you be a little bit overprotective? So is it okay if so for example, if I'm going outside to put out my garbage, do I need my mask for that or not? There's nobody else around. So maybe, I'm okay to do that. However, if I'm going into a public space, no, there we need to enforce. Okay, so maybe questioning the thoughts we're having in our heads, and also taking control of things we do have control over.
Okay. All right. No, that is so true. And again, just the scenario is so spot on, because I for one just well, let me say one individual might be practicing the necessary protocols just to make sure that they don't take this virus home, but then you have someone else in your working environment or in the garden space here at the chapel, who just really don't care. And how bold, or should we say, how would we approach an individual like that? Hey, are you mindful that we're in a pandemic and that you need to take the necessary precautions? Are we should we step out of this self mode where it's about me and I am fine, so there's no need? Or should we just say you're in my space and I care about my surroundings, so go do what is necessary to protect yourself and those around?
I think that's a really valid concern as well. And so one of the things to remember I said people perceive situations differently, they appraise them differently, and they react differently. So whereas your level of concern may be here, somebody else's might be here. So one of the first things is understanding that people will react differently. And then the other thing, so when it concerns people being non-compliant with what are measures that are intended to keep people safe, how do we address that? How do we confront somebody with that? And so appealing to a greater good is one of the ways that we can do that. Because you don't want to get into a debate, because then they could probably counter it, where they think this is a conspiracy, or I don't believe that, or these masks are not effective. I think you want to be wary of getting into those kinds of debates with people who you know are not like-minded, because then it could be more frustrating. So appealing to maybe a greater good. So even if you say, I know you might not think you're at risk, but we have to think of other people. So like I have an elderly mother at home, and so, I'm actually doing it for her, not me. Or we're doing it for all the people who are at high risk, all the people with pre-existing conditions and chronic illnesses, the elderly amongst us. So sometimes trying to find that common good and the greater good, maybe we could appeal to people's good senses. And one final note I wanted to share with you is that one of the studies we've done in Trinidad looking at public agreement with public health measures, we found a gender difference. So we found that men showed less agreement on some of these measures. And this is actually a consistent finding in the literature. So one of the things we've also suggested is gender-specific targeted messaging. So maybe we need the men to talk to men, that, warn them about going to the bars, warn them about wearing a PPE or sanitizing, etc. So that's also the thing. It can affect people differently within the population. Thanks.
But that is so interesting, because when I look at the research that is published, we find that it is usually the women or females have the higher rate of contracting the virus. But the irony of it is that I observe that most men go without wearing the mask and taking the necessary precautions. It's so
well,
ironic.
Timar, if I mentioned there, actually the rates of complications and mortality are higher for men as it pertains to COVID. So the deaths, if you examine the deaths and not just who is getting infected, I'm not sure what it's like in Jamaica, but certainly in Trinidad, we found that, and in some of the international literature, that more men at risk of dying from the illness are getting complications. So we're seeing here, that this is a complex thing, a lot of social factors at play as well.
Okay, interesting. Let me just remind persons that the chat is open for question and answer. So feel free to shoot your questions by raising the hand, or you can unmute. The mic is unmute, so you can ask your question. We still have both presenters here who are more able to answer your questions much better than I would. All right, so let's take advantage of that opportunity that we have here. And I'm seeing here in the chat that persons are really glad and thankful for the information. It's quite informative, quite knowledgeable, quite useful presentation. And by the way, let me put you on the spot, ladies, by requesting that you will share your presentation with us so we can get to practice what we preach here at the Mona Library through your research. Yes. Thanks in advance. Dr. Carr, may I put you on the spot? Any thoughts you would like to share?
I'm actually, it's been such a really rewarding morning that I really don't have any last words, because I'm sitting here thinking of all, first of all, we got a lot of data, we got information from that study. One of the things that I had questions about was why, and I was going to ask Prof, why is it that younger staff would experience more stress? Because I think that's what one of the findings from the research, that younger staff were experiencing more stress. And I would have thought older persons would be more stressful or experience stress. So that was one thing. But I'm just awed by the data that we have before us, and then the tips on coping. I know that when I go to do my nails, I fall asleep. Why? Because it's one of the few times that I relax. I'm telling you, so they're always kind of saying, you know, you're sleeping. I said, you know, maybe this is, I need to sleep. So I know getting nails done, all of those things. But I mean, I'm looking at so many of the tips that I'm also trying to pull in what it is that we can do more of for our community in the library. So I, as campus librarian, I am thinking too, how can we make it different and maybe better for staff members in the library? I know Mr. Heron has exercise on Wednesday afternoon, and everybody's into that. Invariably, I'm in an FNGPC meeting late on a Wednesday. So, but so I'm thinking, because all of this is so good, it's so useful, that I think we need to move it from just here and take it to practice. So what are we learning from the data? How can we help persons even deal with their stress levels and their anxiety levels? But also, how can we help persons to cope and with what is happening? Because as you rightly said, there's not an end in store for us, in view for the pandemic right now. We're being told, we were in a meeting maybe 2 weeks ago, and one of the medics said to us, oh, next summer we will still be having this thing around us. Is that being negative, or is it being realistic? So it's how are we going to utilize what we have learned today, because this was really rich from both sides, and how we're going to put in place things that will help us to cope for the months that lie ahead. So I think those are my last words, really, and just to say thanks to the presenters and thanks to the health and wellness team of the library for inviting you and for really thinking about the wellness that is needed from all angles for us. So those are really my last words. Thanks to everybody.
Okay. All right, well, while we're on the note of thanks, we'll ask Mrs. Wall Johnson to come to us with our vote of thanks, since we're in this thankful period, right?
But there's a question here, Mr. Heron, if I may, and we
Sure.
have to deal with it afterwards, but maybe off air for Dr. Khan and for Prof, whether credits can be given for this presentation. Apparently there are some medical students who are participating and want to find out how we deal with it. So it's probably a discussion for us after.
Okay. Yeah, we will definitely have that discussion afterwards. But a member of our team had actually answered that question privately.
Okay.
Already.
Okay.
So,
all right.
But definitely, because it is quite interesting, because a number of persons have been asking about it. So we will definitely have that discussion.
Yes. Okay.
Good afternoon, everyone. I'm smiling because Dr. Carr must be right beside my shoulder and reading my script. She took a lot of what I intended to say. It cannot be denied that as we physically navigate this untrodden path, our psychological coping and wellness is especially important as we are all being driven along this COVID-19 roller coaster. Our heartfelt thanks to both presenters, Professor Maynard and Dr. Khan. Your talks on the psychosocial, emotional health of our staff cannot be overemphasized. Anxiety itself impacts not only our mental health, but our physical health, and your talks show that resilience and strategies for working together, for networking, regardless of the level of staff, will impact our coping mechanisms, whichever way we try to employ these. Dr. Kando's exercises are simple but so useful. I believe I speak on behalf of all present when I say the information imparted has had us all engaged, and it was the combination of useful data and material that we can actually connect with as we navigate that will see how best we come through this together. With the wellness team, also would like to thank Miss Alison Johnson, who acted as liaison. She kept the channels of communication running between the team and our distinguished speakers. Thanks as well to Dr. Carr, our campus librarian, who has continued to support and to encourage the work that the wellness team has been engaged in. We also wish to thank the systems unit and our outreach librarian who have been on board from the onset. To the members of the health and wellness team, you are stewards for the cause. Continue to work hard as we continue to try to balance between health and wellness. The staff of the Mona Library, who all work together, please continue to maintain your efforts at wellness, and thank you for your continued consistent support. To all our attendees, thank you for spending the time with us. This was our third webinar. Those who joined us on YouTube, we do hope that this has been impacting. Thank you.
And thank you, Mrs. Laura Johnson, for doing our vote of thanks. And my final note is really to invite persons to our Instagram page, right, where we have a wealth of information. We only just started 2 weeks ago, and we have published have like 30 posts already, making comparisons between the H1N1 and we have a series of that and the COVID-19, and how persons back then were just being naive of the virus and what it was capable of. But what was interesting is that they did not have technology, and we do, and yet still today we are doing the same thing. So I'll invite persons to check out on our Instagram page, #LHEWco. And I again, ladies, would love to thank you. And I hope I'm not insulting by saying ladies, because I know you have worked hard for your titles, Dr. Khan and the Professor Maynard. Right. I thank you very much for your presentation, and it has been very informative, very insightful, and we will definitely be putting things together for phase 2, because your research was done in May, you said, right? And so we will want to see an update and to provide to you information what we have put in place because of what we have learned from your presentation, right? And so we do look forward to phase 2, where we can have another insightful presentation from both of you. Thank you very much from the Mona Library, and we do look forward for working together under the Untitled umbrella. And please take care and be safe. All right, any last words from you?
Oh, I would just like to say thank you. Thank you for inviting us to share. I also want to thank Alison Johnson because she was the person that was able to open the door and connect us. And I thank you to the audience for the great questions. And I hope that, yes, that we are able to move forward, do the second phase of our wave of data collection and see how things have changed. Remembering that the university is striving to put everything in place to make it as easy and comfortable for us to adopt the necessary practices in order to keep everyone safe. Remember that we're all our brother's keeper. So, right, so we need to look out for each other as well as ourselves. Thank you.
No problem. All right, Dr. Khan, are you good?
Oh, I think.
I'm sorry. You in Jamaica. How you going? What's that? What was your comment? How you going?
How you going?
How you going? All right. All right. So we will say we say in Jamaica, what a go on. Wagwan. Yes. All right.
Yeah, so just to echo Professor Maynard's sentiments, and we do encourage anybody to look out for that repeat survey closer to November. We do encourage you all to take part. And you know, you mentioned the campaign, you know, about us being stronger together. And even at the COVID task force, we talk about together we can all get through this. And I really think that's the ethos we need to move forward with. It's difficult, but you know what? We're going to get through this together. So thanks to everyone, and be safe, and everybody take care.
All right.
Bye-bye.
All right.
Bye.
Thanks much. All right. Stay safe.
Bye-bye.
All right.
Do you want to stay on or do you want to